Welcome to Evidence Based, a new Harbinger psychology podcast. We're your hosts, Cassie and Kendall.
On today's episode, we're talking about health anxiety. Our guest is Dr. Lynn Cassiday, author of Freedom from Health Anxiety. She's the owner and clinical director of the Anxiety Treatment Center of Greater Chicago, the Upper Midwest's longest-running exposure-based treatment center for anxiety disorders. She has served as president of the Anxiety and Depression Association of America, chair of the Scientific Advisory Board for Beyond OCD, and has published numerous articles, a book for parents of anxious children, and numerous scientific publications that advance the understanding of anxiety disorders. She is a popular commentator in the media, radio show host, and TEDx presenter. She is also the clinical assistant professor in the Department of Clinical Psychology at Rosalind Franklin University of Medicine and Sciences. She won the prestigious Clinician of Distinction Award from the ADAA, is an ADAA clinical fellow, a founding fellow of the Academy of Cognitive Therapy, and one of its certified trainers. Hi, Karen. Thanks so much for joining us today. We're so excited to talk to you about a very important topic.
Hi, I am so glad to be here because I think, illness anxiety and health anxiety is something that's incredibly timely with the pandemic that we've been living through. And I think just people's heightened awareness about health and illness.
Definitely. And that makes our conversation extremely timely. Of course, people who have health anxiety understand more about it than people who are new to the topic. So let's start with an establishing question. And can you talk about, at the base, what is health anxiety and how can you identify when it's a problem?
Yeah, well, this is a great question because, honestly, it's been a confusing one for professionals, whether they're doctors or therapists, and also for people who are, patients who have actual illnesses or lay people. And so what we understand health anxiety to be is where someone has a constant worry or repetitive worry about having a serious illness. And by serious, we mean where it's disabling or it could lead to your death, or it could be about someone else. So maybe you don't worry about yourself, but it could be your child or your partner or your parents. And then what happens with this worry is that it's based on noticing real physical symptoms. Okay. But what happens is the person mistakes usually ordinary phenomena that happen in your body. And, and you guys are aware of this, where sometimes you get an ache or a pain or a headache, or you just don't feel great. But if you don't have health anxiety, it doesn't reach the threshold of concern. Well, for people with health anxiety, it's like they have this long range, overly sensitive radar for noticing physical changes in their own body, or paying attention to other people's health. And then that worry gets stuck. And so even though they look up information, or they talk to healthcare providers, or they talk to the doctors or the pediatrician about their kid, it doesn't allay their fears. And the fear comes back. And what we see is the more they try to get reassurance, the worse it gets. And the other thing that is so unfortunate about health anxiety is so many people misunderstand it. For a long time, if you hear the word hypochondriasis, the picture that people get is like, this must be a really neurotic, seriously disturbed person who prefers illness or has some, secondary gain. Or we think of Munchausen syndrome, which is where someone seeks attention through inducing medical illness in themselves or others. And those things are actually not what happens with health anxiety, that people who have it absolutely do not want to be sick. And there is no secondary gain for them. They want good health. The thing that is so hard for them is that when they don't have an obvious sign of a terrible illness, or some kind of obvious sign and guarantee of total good health, then in the middle, they start misinterpreting all these ambiguous things as being dangerous. And then it triggers their worry and their physical anxiety, and they just get miserable with it.
I was going to ask about hypochondria, and is this calling this term health anxiety? Is this sort of a new thing to call something that was hypochondria that did kind of have that really negative connotation, or what do you think?
Well, it's more than that. This isn't just trying to, pretty package on an ugly thing. It's actually a modern understanding of what happens when people get caught up in this kind of worry. And the way it's different is the hypochondriasis idea was based more on Freudian concepts, the idea that you always have some deep inner reason for doing something that doesn't make sense to other people. And what we really understand now with any anxiety disorder is people are accidentally doing things to get rid of their anxiety or their worry fast. And then the things that they do accidentally make it worse.
Yeah.
And this is the problem. And then the other unique thing we see about health anxiety or any anxiety disorder, but particularly with health anxiety, is people don't know how to handle ambiguity or uncertainty. And so they take a better safe than sorry strategy where they decide, okay, I'm going to eliminate all that uncertainty. I'm just going to think about the worst case scenario. And the unfortunate thing for every human being is our brain can't tell the difference between imagined fear and a real dangerous situation. And so our heart, our body, our stomach reacts to a horror movie just like we were actually in the situation. Or when we're plummeting down a horrible roller coaster, we act like we're falling to our deaths, or our body does. Same thing happens if you imagine you have terminal cancer. You get those same feedback in your body, and then you get this vicious, what we call negative reinforcement cycle. And that's different than being neurotic. It's different than having something wrong with your personality, because we see that health anxiety is an equal opportunity illness or problem. It strikes people who are the most robust examples of mental wellness, and it can strike people that have, every problem you can tick off in the manual of diagnostic codes. And it's all about how you handle uncertainty about your health.
Well, and going back to that, it can affect anyone, like you said. But what, in your experience, is there something that is more common in people who have health anxiety, such as with someone in their life who had a terminal illness or some sort of trauma in their early life? What's the through line there?
Yeah, that's a wonderful question. And one thing that we do see is that people who have this particular problem are born into families that tend to have anxiety disorders. And so we see there's just a climate around them where people are accidentally acting like it's bad to be worried. You have to escape it quickly. You have to get reassurance, or you can't trust your own judgment. You must get a medical professional's opinion. So we see that's there. And then the other thing that we see is for many people, oftentimes there is a personal experience that makes them more aware, where they feel a deeper sense of responsibility or a stronger sense of commitment to their health. And so we know the peak age of onset is in young adult years, but I can't tell you how many people I've worked with where they had a close friend who got diagnosed with breast cancer when they were in their 20s. And then they started worrying and constantly checking and constantly getting concerned about cancer where they never had that fear before. Or they grew up in a home. I've had a lot of patients where they had family that would warn them, you don't get sweated up. Because it might be a fever. It might be dangerous. And so they're getting alarm messages from the environment that are saying a bad thing could happen, or it really does happen when you least expect it. And then they handle that alarm by starting to get reassurance. So they start checking their body or someone else's. They start reading information. And unfortunately, the internet is never anyone's friend. Have health anxiety, because if you've ever compared all the terrible diagnoses, they all seem to have aches and pains, headaches, dizziness, fatigue, discomfort, fogginess, fuzzy-mindedness, and quite frankly, those happen to most people a couple times a week.
Sure.
So there's these huge lists of these non-specific symptoms that if you are reacting with alarm, you're like, oh my God, that's me, or that's my child. They keep getting really hot at night and waking up. What if this is night fever that goes with childhood leukemia? And so we see there are significant events like that. And then the other thing I've seen is when the media cycle features an illness. Okay, so let's say a celebrity gets colon cancer, or they have breast cancer or cervical cancer. I found a lot of times patients react to that because all of a sudden they get the idea, oh my God, what if that's me? Or what if that's someone I love? And so there certainly can be environmental triggers. And the majority of people I work with can point to something like that, or to the alarm of their parents and grandparents every time they had any kind of thing that might possibly be interpreted as a medical symptom.
Definitely. And I think, of course, I have to ask about COVID. I feel like as a trigger, I'm just really curious, and maybe you've seen some of it already in your practice. It's this huge global trigger. And I feel like it's maybe, presumptuous, but health anxiety feels like it's going to be the next following events of the pandemic. Like, it's very in our awareness. It's the symptom checking, the same symptoms you were just talking about for everything are also COVID symptoms, and the hyper awareness.
Yeah, and one thing I can say that I have seen is, my practice and amongst my friends around the country who work with anxiety ridden people, is that we definitely have seen an increase in anxiety about health, and in particular about COVID and long COVID, getting the very severe disabling symptoms or dying. And the thing that's been really hard is that initially, we were told all this frightening information that was truly terrifying, and then given confusing instructions about what we were supposed to do or not do, and all these alleged experts. I remember one patient sending me this video where this guy was a physician was showing how he brought groceries into the house and sprayed them with alcohol and washed everything. And you may have seen this video.
Mm-hmm.
And treating it like it was a surgical theater, preparing for an operation. And of course, that was unnecessary. However, I still have patients who are using that approach. They're afraid to let go of it because they have been doing this so long, it reinforces their anxiety. And so we have a lot of clients where they haven't been able to get out of their home. They're washing their masks because they're thinking, what if, someone spoke loudly, and so that projected more, aerosolized COVID germs because this person wasn't perfectly safe about how they were at the grocery store and didn't seal their mask properly, and therefore they could have it COVID, and just getting into these horrible dilemmas where they haven't been able to resume life. And if you look at most of us, as of a few days ago, when we had a national lifting in the United States of the mask mandate, most people are like, yes, let me out there. I'm vaccinated. That's good enough. And they're beaming at everybody. I mean, that's what I've been seeing. The sorts of people are just beaming at each other and going, space is free. And people who have COVID anxiety are feeling like, well, we're being too hasty. This is unwise. We're not being responsible with how we're handling this. And they're erring on the side of caution, which sadly is affecting their mental health and their relationships. And that's something I should bring up. Is one problem with health anxiety that doesn't get mentioned in the diagnostic manuals, but which I see is it creates interpersonal problems because other people around you can tell that you're anxious and that their reassurance doesn't work, or the physician or the nurse's reassurance doesn't work. And they get frustrated because you're having such a hard time stopping asking those questions or researching or asking them to check or look at something or touch something or compare pictures that you took of how this alleged rash looked yesterday versus today. And it can create a lot of conflict. I've had people come in where they're there because their partner has said, I'm leaving if you don't do something about this. I think you have a problem with anxiety. It's not your health, and, go do something about it or say goodbye. That has happened. And then unfortunately, I've had physicians send to me people saying, I'm firing this patient. I refuse to see them. They don't trust me. They don't believe in anything I'm saying. And I told them if they ever want to come to my office again, they have to see you or someone like you.
That's
And
tough.
Yeah.
that is tough. And that also shows just someone not understanding how anxiety works and realizing no one wants to be like this.
Yeah.
Right.
No one asks for this. And people who are doing it are aware of the fact I'm caught in this vicious cycle of worry and physical anxiety and checking and reassurance seeking. And I wish to God I could feel good about my health and not have to do this.
So when someone's in sort of this spiral of like noticing like, oh, I just noticed a mark on my skin. Oh, I'm going to look up my little melanoma chart. Oh, I'm going to call my doctor. What is something that someone can do to sort of take a step back and realize that they're triggered and have, something to do in that moment instead of that reassurance seeking?
Yeah, what a great question. Well, I think the first thing is you have to accept the idea that my real problem is not my health. It's how I handle anxiety about my health. And that's step one, is to restate the problem. So instead of believing your worry that is telling you, what if I have melanoma, or what if I have cancer, or what if I've contracted COVID, or what if I have ALS, you need to realize, okay, this is a worry. And I want to restate it as, right now, my anxious imagination is trying to convince me of the worst case scenario. And this is just a worry. So part of it is like restate the issue as not that I have it and I want to find evidence that can prove that I don't, but instead that right now my problem is I'm worrying, and it's not the content of my worry, it's my worry that's the problem. That's number one. And then number two is, if you're feeling brave, we know that doing worry exposure is incredibly powerful. And it can work within 15 to 30 minutes. And it's very effective. And the way it works is it helps you get used to the idea and to stop having the constant physical arousal. And then, because your brain is not overwhelmed, your frontal lobes aren't overwhelmed, you can all of a sudden see through it and realize this is kind of absurd. Okay, how did I get from a dark spot on my skin to I'm preparing my funeral? And so here's how we do worry exposure: is you just take the thing that you're most scared of. And so I'm going to use your melanoma example there, Cassie, and to say, what if this spot is melanoma? What if it really is melanoma? And you repeat that over and over. And then you repeat any other ideas that come along with it. So if your mind goes, what if it's melanoma and I have to have a huge surgery, and then chemo doesn't work and radiation doesn't work, and then I die and I never get to grow up and have children or grandchildren, then you want to say that. But what you do is you say it over and over until one of two things happens. Either you have this aha moment, you go like, oh my God, this is absurd. And I've seen this happen thousands of times with patients, where it's just like all of a sudden you're like, why am I stuck on this? Or you get used to it enough, you're not feeling like you want to cry. You're not having a panic attack. This isn't something that I have to believe in. I don't have to react to it this way. And we know from research and clinical experience that for most people, it's going to take somewhere between 10 to 30 minutes if they just stick on that thought. And the trick to this worry exposure is to either write it or say it out loud. Because if you just kind of in your mind go, yeah, this is a worry thought, and you sort of think about it a little bit, you're actually not allowing your mind to process it or your body to get used to it. And we've seen that writing or speaking it out loud works best. And so one hot tip I have for anyone who listens here is record your worry exposure. And you can use it again and again and again, and listen to your own voice, and that will really help too. And you don't want to do it while you're doing something else. So I've had some patients like, well, I'll do this while I'm folding the laundry or while I'm driving to work or while I'm eating my lunch. And the problem with that is it's distracting you away from what you're trying to make yourself think about. Because one of the things that most people don't realize is when you're worrying, what you're actually doing is flitting around all these little really frightening ideas, but you're not spending enough time thinking about them to be able to see they're kind of silly, they don't really fit, or it's just one possibility and all the others that are nice are actually much more likely. And then it keeps it scary. So I would want to say recognize the problem is not the content of what you're worrying about. It's the fact that you're worrying about it. And that means you got to work on the anxiety. So worry exposure is one. And then another tip, and this one is, I found is the hardest thing for everybody, is to give up reassurance seeking or to start cutting back. And by reassurance seeking, I mean all those things you do where you try to bring up the thing that you're worried about in conversation so you can see, have your friends ever had something like it? Did they think it was dangerous, or did they, go to the doctor, or what did the doctor say to them? So you can kind of get some, hopefully, information that tells you, oh, it's no big deal. Or going to the doctor, or the pediatrician, or here's the biggest one, going to the internet. And in my book, I talk about you've got to break up with WebMD. And that for a lot of people, they have a bunch of things on their phone, their iPod, or their laptop where they can do that super speedy search, or they put pictures of the rash or the bump or the lump, and then they compare them, and they're trying to get reassurance. And so we've found if you can get rid of reassurance, you can get rid of a boatload of your anxiety. It does mean, however, that you've got to be willing to live through that moment where you're feeling like, I can't take it. I just want to make sure this isn't symptoms of multiple sclerosis or terminal cancer. And I've had patients where we've blocked websites. So all those websites that show you different symptoms of cancer or different rashes or stuff like that, so that you just can't get anything from them, because for many people, they've searched so much, they get a lot of stuff. To eliminate apps on your phone that have to do with health information, the Mayo Clinic, Harvard, whatever. And then the other biggie is to ask yourself, am I actually doing what my medical team tells me to do, or am I leading the treatment with my anxiety by suggesting to them which tests and things I should get, or even am I begging for them because I just want to know for sure I'm okay? And that is naughty when it comes to anxiety. That is going to accidentally make it worse.
Of course, the irony with health anxiety is that you're putting so much of your time and worry and effort into the problem. And then when it comes time for the solution, like you're saying, to spend some time in that worry exposure, people want to do it while they're distracted, or they don't want to give it the full attention that they're giving the worry for their health anxiety and researching. And so I think it's really powerful to remember giving it your undivided attention, using your own voice. So I found that really powerful. And the other piece that is really interesting is in the reassurance seeking. And what I learned from your book is that you try to seem subtle about it. You're trying to bring it up in subtle ways, asking people if they've had this, or, you're not trying to really come out as someone who's struggling with anxiety. So it's a really hidden thing, but to other people, they start to detect that nervousness and anxiousness. And kind of going back to the triggers, I was curious. I know that heart rate monitors or fitness watches and things can accidentally be a trigger for people. On the one side, it can do a lot of good for your health, but then on the other, you're really tuned in to your heart rate and levels and things like that. So I was curious what your thoughts were about wearing a health rate monitor. Is that a form of avoidance by staying away from it, or can it be healthy for some people who tend to fixate on those statistics?
Well, actually, both of those things are true. So I have some clients where they're using their Fitbit or their Apple Watch or you can get a pulse ox monitor on your app that emergency departments use. You can do your own EKG on my iPhone. That they do that for reassurance. So for example, if they feel like, wow, what if my heart's kind of uneven or I'm sort of out of breath, I'll check my oxygen level. And of course, with COVID, we all learned about oxygen saturation and those became readily available. If you're doing it to feel better in the moment, just to make sure, and that's usually the thought that someone has in their head is, I just want to make sure things are okay. So if you are doing something with a health monitoring device or app just to make sure, then I can pretty much promise you that is making things worse. And you would need to give that up or wean yourself from it. And you can either decrease the amount that you do that, because I have some people where they're just, every time they're looking at their watch, they're punching that little button that goes to the oxygen monitor, the heart rate, or the number of steps. And the reason they're looking at the steps, I've had one patient where they figured if I could do at least 10,000, then that means I must not have ALS or multiple sclerosis because I'm acting like a super fit person. So you have to ask, why am I doing it? If it's just to make sure that I'm not in the bad category of people who will become disabled or die, and at this moment, it'll make me feel better if I do it, then that's what you need to give up. And then on the other hand, I have people who are avoidant. And that's where they don't want to have any tests. They avoid going to the doctor. They would never look at their heart rate or never look at their health data or their cholesterol or whatever, because, oh my gosh, what if it's bad? And so I do have those clients where they have not seen a doctor in years when they ought to, just for good, health maintenance and prevention. And it's because they know their worry is so bad, it's convinced them this time I'm going to get that diagnosis. And they can vividly picture the doctor coming in with a very worried expression, or the nurse having oh God, I'm so sorry, you're going to have to talk to the specialist look. And that is what keeps them away. And for those people, then we want them to start monitoring as a form of exposure practice. And their worry exposure would be all about how I get an assessment or I notice my health monitor and it's the beginning of the end. This is the fatal first symptom that is detected, and I'm just going to go down the tubes and die or be disabled. The thing that I've seen that's tough is because these health monitoring things are so easy now and they're everywhere, it's just way too easy when you're trying to get reassurance to use them. And the same with the internet. And I noticed, once phones could start letting you do internet searches, I saw patients doing a much higher volume of reassurance seeking than I'd ever seen before in my history of working with patients. Is you can do this all the time. You can do it in the middle of a meeting if you're feeling worried. You can do it while you're watching the TV. You can even tell Siri or Alexa to search for you while you're driving. You can do it anytime.
Very readily available.
Yes.
Yeah. I want to ask about symptom manifestation. So not just over checking, but when you're anxious, that comes with a lot of physical symptoms, heart palpitations, heavy chest, maybe shortness of breath. So what are some things, aside from the two I mentioned, that your anxiety can manifest, and why that sort of feeds into the cycle, right? Because you're like, I have this symptom, I'm going to check.
Yeah. No, the unfortunate thing is the physical symptoms of anxiety also mimic that big nonspecific list of symptoms of terrible disorders. And when you have health anxiety, you can have a full-blown panic attack. And that's where you get 4 or more physical symptoms, like an increased heart rate, sweating, feeling like I can't breathe, like I'm kind of choking or can't swallow. Stomach upset is huge. where you can get sudden urgency to go to the bathroom, cramping, pain, butterflies. You can get, if your anxiety is really bad, feelings of numbness or tingling in your hands or your feet or your face. And obviously, if that happens, many people with health anxiety worry, oh my God, what if this is like a stroke? Or what if this is ALS or multiple sclerosis or one of those degenerative, neuron diseases? And then you can have the best way to put it is your skin can tingle, your muscles can get achy and tired because you're holding so much tension. And then obviously sleep gets disrupted. So a very common thing for patients, they're telling me I'm waking up and I'm having a hot flush or a hot flash, and it's an anxiety attack because of the worry. And then they're worrying, oh my God, what if this is that nighttime sweats phenomena that goes with lymphoma or leukemia? And then you can have visual perceptions where you feel like you have tunnel vision, and people worry, what if my optic nerve is separating from my retina and I'm going blind? And so those are just some examples. And the other thing I think people should understand is a lot of times when we think of anxiety, we tend to think of the mental experience, the worry, but anxiety is always a physical felt experience too. And so it's a combination of your body accidentally overreacting to a false signal. And so part of what you're doing when you're getting over this learning is I'm getting a false signal from my body and from my mind not knowing how to handle an ambiguous thing, like I feel this bump that I'm not sure I felt before. And then going into this huge, oh my God response. And that's what happens.
And I'm curious, Karen, because a lot of those, when you're talking about panic disorder or something manifesting with multiple symptoms at play there, I know a lot of times someone's going to seek medical attention, especially if it's the first time they've ever experienced those things. And then they can get, a response from a doctor that it's just a panic attack or it's just anxiety. But those things felt really real. How do you handle with clients advising them when they do need to go to the doctor or when it is their anxiety? Like, what's the line there? Because I imagine it's really delicate.
Yeah, well, in order to receive the official diagnosis with health anxiety, you have to have had medical reassurance that you're in good health. So in other words, you can't have an illness that hasn't been diagnosed yet. And certainly people with chronic or terminal illnesses can get health anxiety, that it can happen to anyone in any situation. And this might help the listeners understand, typically people with panic attacks are afraid of the actual symptoms. So they're afraid that my heart is racing, and they might be feeling like immediately this moment I might die or I might go crazy, but they're not worrying about the future. Like, what if I have a bad thing happen in the future? And typically with a panicker, if they're told your heart is fine, you're not having a stroke, this is an anxiety attack, most people feel relieved. They're like, oh, thank God, and that actually helps a lot. However, with health anxiety, that doesn't help because there is always this little worry that oftentimes is unspoken that says, well, what if the test missed my diagnosis? Because most people know there's a rate of false negatives, which means there's a certain percentage of people where the test won't properly identify that they have it. And we've seen this in the COVID pandemic. Everybody is talking about false negatives and false positives and stuff that no one ever knew about before. And then the other thing people worry is like, well, maybe I was okay then, but what if now my body is producing cancer cells? Or now it's having the degenerative disease, and maybe I was okay up until now, but now wouldn't you know it, what if everything is falling apart in my body? And that's why tests don't reassure, or the doctor saying that. And then the other thing that happens to people is if people have, for example, obsessive compulsive disorder, and they're thinking about a physical symptom or health, they right away realize it's kind of a nutty idea. I know it isn't really true. And that's different from people with health anxiety. People with health anxiety believe in their worry. And they have a unique set of beliefs that other people don't have. And one of them is it's a tragedy if anyone ever gets a terrible illness, and that should not happen, that children should never get cancer, people should never die before they've lived a long lifespan. And if you have health anxiety, that may sound like, well, yeah, that's a perfectly reasonable belief. That's terribly tragic. Well, when we look at people that don't have illness anxiety, they actually think about it differently. They agree that it's sad, and they think that's very unfortunate, but they don't look at it as it's a unique, terrible tragedy. They accept the fact that there's this random quality about bad things happening to people, and they don't feel like it's special persecution. And the other thing, and that brings up this, is we see people with health anxiety view serious illness as a terrible victimizing experience. So instead of being sort of your human lot, where you might be one of those unfortunate people that has something, that it means that something uniquely bad happens. And I hear a lot of patients I work with saying stuff like, God must be punishing me, or fate is punishing me, or what if my family gets picked on? This would be so bad. And if they hear about other people, they assume it's sort of like a punishment from the universe. And that sets them up for overreacting to triggers, because there's this feeling of, this is uniquely terrible and I have to protect against it. Where other people have I'm going to say, a more accepting way of thinking about it, even though they agree it's very sad and unfortunate.
That's really interesting. And I think that's a really good differentiation of people who struggle with illness anxiety. And I wonder, why do you think it is so hard for those suffering with health anxiety to accept that clean bill of health from their doctor? And why do they keep investigating it themselves? Like, I think there was one example in your book where the person was like, I need a second opinion. And then they hired like a separate concierge doctor and kept, spending money investigating it themselves.
Yes. Well, we see that what's behind that is the mistaken belief that I could actually get 100% certainty, a total guarantee of a clean bill of health. And the dilemma is, if you're a thinking person at all, that's not possible. So you're trying to attain the impossible, which is, I want perfection and a guarantee for the rest of my life, or the rest of someone I love's life, that nothing bad will happen. And when I put it that way, I'm sure you realize, well, that's impossible, because none of us knows the future. We can only know today. And it's that desire to get a guarantee that drives people, and the belief that would actually be a good thing. And then another belief that we see that is, besides that it's a persecution if this happens and it's a terrible tragedy, is the idea that certainty is possible to attain. And the person is fundamentally believing, I can't handle uncertainty about my health or someone else's, and I'm going to be the one person that gets a guarantee. I'm going to have 5 years of perfect tests with nothing ambiguous, and then maybe I will relax about the possibility of cancer or some other terminal illness. And that's why people will go to great lengths to pay for tests. Unfortunately, now we're talking about the internet. You can order most of the lab tests online and get online pharmacies and places like that to do stuff. And I found that's a new way that people get repeat testing, is their doctor may have said, I am not doing this anymore. You're fine. Then you can just go on Amazon and check whatever that thing is that you want to check. And it's not helping. And then the other thing that I see that contributes to this is the desire of your healthcare provider to not be the one who drops the ball. And a lot of people don't think about, what is it like to be the person who works with someone who's really worried about their health. And many doctors and nurses want to make you feel good. And they want to be the one that gives you that reassurance. They went into healthcare because they want to help people, and they can tell they're not helping. And so they oftentimes think, well, if I just did another test or let you do this again or got you another scan, then that would convince you, because that's what would convince me. And they forget that it's the uncertainty that's the problem that needs to be managed, and that test isn't going to help.
Well, it's interesting too, because yes, your healthcare provider is supposed to be the one that you trust, and yet you just can't get that reassurance. So it is this cyclical pattern. And from your book, I found it really interesting talking about the mammogram example and how by accidentally, trying to reassure yourself and getting multiple mammograms, you're actually exposing yourself to the thing you're scared of, to the radiation that would be cancer, inducing. And so I think that's a really, it's just a very interesting cycle to be in. I once heard that differentiating someone with health anxiety from someone without is that someone with health anxiety kind of views themselves as something is wrong until proven right, whereas someone who doesn't have health anxiety has a clean bill of health until proven wrong. So that's kind of the scales there, which I found really enlightening to see it from that point of view. But talking about the healthcare system, you talk about in your book how they can accidentally promote some of this health anxiety. Can you talk a little bit about that?
Yeah, one thing that I've seen a couple different ways that this can happen is, you've got to remember, number one, your healthcare provider might actually have an anxiety disorder. They might be someone who's prone to worry or perfectionism about getting it right and never making a mistake with a diagnosis. And I've talked to healthcare providers say, well, I like to make sure. And they're saying the same thing that people with health anxiety have. And they order extra tests and they're proud of that fact. I will do that. And then if they happen to be the one who's working with someone with health anxiety, it is like the perfect bad marriage where you drive each other anxious, because what people with health anxiety say is when a doctor says, yes, I'll order this test, they tend to take it as, wow, they think there's something really wrong. And I can't tell you how many hours I have heard people say this where everybody else is assuming, well, they're just doing it because it's their job. This is your annual physical, or this is your 5-year thing. You're supposed to do it. And they're assuming the reason I'm getting this test is because there really is a good reason to do it. So that's one. And then the other problem is if your provider has anxiety about, wanting to make sure, then they're going to likely talk to you in a different manner. And they're going to be afraid to straightforward say, you're fine. And they'll say stuff that promotes ambiguity, like, there's a 5% chance that your child could have brain cancer. But we're going to do these scans just to make sure. And, and then we're going to also do these tests, these neuropsychological tests, because sometimes the tumors don't show up in very young children until they're, past a certain stage. And then, of course, someone with health anxiety hears that as, my kid has cancer. And any chance is a bad chance, as opposed to other people would hear it as, 95%, that's the same as saying my kid doesn't have cancer. I'm cool. We'll do this because they're ordering it, but I'm not going to worry about it. So that happens. And then we also have the phenomena of healthcare people who have been taught practice defensive medicine, cover your backside and order the test and don't make any promises. And I remember some years ago, I had a friend who was an attorney that worked for a large university medical system. And he spent most of his days educating doctors how to basically not reassure patients, because they didn't want any patient to be able to come back and say, you said I didn't have this, so I'm going to sue you. And so they talk like statisticians, and they're also trained this way in medical school or nursing school. And they say stuff like, this panel here shows that things are probably right. However, we know there's a 13% chance that in 2 years' time, This sort of in between result will convert to something positive, and it really will be this terrible illness. I just want to make sure you understand it, that this is not a guarantee. And then you sign this very long release form or consent form that says, I understand basically that what my doctor tells me might be wrong, and I won't sue them. And that creates terror for patients. And then if you contrast this with a healthcare provider who's not anxious and who's willing to take the risk of saying, I might call it wrong, or the test might not have detected it, is normally what they say is, hey, we got your labs back. They're looking great. I'm not worried. And you can go home. And that's different than the anxious one say, well, we're slightly elevated here in this area, but it's not within the range of concern, but I want to bring it to your attention. And there's this other thing, and this happens in about 20% of the people who get it, but it usually means nothing. And someone with health anxiety is going to way overreact to that. And so those are tough situations for patients to handle, because our system isn't necessarily set up to treat anxious people in the healthcare zone.
Yeah, and that brings up the point about like sort of the preventative screenings. For example, like the melanoma example was my mom died from melanoma, and I have a lot of moles, so I have to check them every year. But then you go in for your yearly checkup and they're like, well, we can only capture what we're looking at in this moment, and you have to check yourself every couple months, and then it leads to like all this extra screening they're asking for. And in theory, you're like, okay, I can just go for my yearly checkup and be good. And then it sort of like just keeps promoting that checking, right? Or, there's all the doctors always commenting on people's weight. Like no matter what doctor they are, they're like, well, if you're overweight, you're high risk for all of these things. So it's just interesting that the medical system is really set up with all this preventative medicine that sort of just cycles into this anxiety.
Yeah, and I think so. One thing that I like to do, and I talk about this in the book with people, is to set up, what is a reasonable way to interact with your healthcare team that doesn't overly promote your health anxiety and protects you from them and accidentally making it worse, but ensures you get good health care. And because that is necessary, it's, advisable to get certain screenings and to, if you have certain risk factors, to do additional things. And so what we like to do is to have the doctor decide what's the right schedule, not the anxiety, and to stick to that schedule. And then we like to have someone have their doctor or nurse tell them, these are the things of true concern that I want you to contact me about in the meantime. This is exactly what it would be. And if not, just write it down and you can, bring it in and we can talk about it. But you want to get out of that pattern of anxiety being the boss of your healthcare. So that's step one. And then you also want to make sure that your healthcare team understands what it means to have an anxiety disorder. So if they believe I'm going to make you feel better by ordering more and more tests or biopsies or exploratory surgeries, you really need to find someone else who understands what happens when you get that accidental negative reinforcement cycle and is willing to take the risk of talking to you and giving you their honest opinion. And by that, I mean saying, I'm not worried about you. Your health is good. And they're willing to say that. And they're comfortable if maybe some of your labs don't look perfect or your weight isn't perfect, and say, I'm not concerned about you. And to say that in a definitive way. Because what I've found when I talk to healthcare providers that work with my patients, they get scared they're going to say the wrong thing. And they're afraid they'll get sued, or the patient will work them into a corner with questions, which the patient usually has done. And they feel like, I'm afraid to say anything, and I don't want, what if it does go wrong? Then I don't want to be held to blame about something I couldn't predict or control. And we want someone that themselves doesn't have anxiety and can calmly say, I wouldn't order a test. I'm not going to let the patient convince me that this time we should do another one or get this exploratory surgery. I'm comfortable saying no. And I can give a good example of this. One of my friends had melanoma that was treated in her early 20s. And she said what she did for the first year is any spot she noticed, she'd rush in and insist they, take it off and examine it. And she said she, probably lost a third of her skin in this pursuit. And after about a year, her dermatologist told her, we need to have a talk. I knew you were anxious and I gave you a year. We are not doing this anymore. The only time something comes off is when I am worried about it, not when you're worried about it. And we're only going to meet at this frequency. And the rest of the time, I would like you to just ignore your skin because you aren't going to have any left by the time you're 40. So, and she said it was really hard to hear. But it really helped. It helped a lot. And she said she doesn't go into checking or scanning or looking in the mirror or telling other people, well, how do you think this spot looks? She's comfortable just going to her dermatologist.
And going off of that, Karen, so having like the open line of communication with your physician or whoever it might be to kind of communicate your anxiety, or you might not be communicating it verbally, but they're picking up on it. Going back to talking about the reassurance seeking trap, but with people close to us in our lives, so our partners or our parents or our friends, what's a way that we can open up the conversation about our health anxiety in a productive way that isn't reassurance seeking, but it's just trying to communicate your experience and move past that with them?
Yeah, well, I think the first and most helpful thing is to own the fact that you have health anxiety. And frequently people who are supporting you feel like you're not owning that because you're coming to them. And so just simply being willing to say to them, I realize I have anxiety about my health and I realize it gets out of control sometimes. And I need your help. And so starting that way where you name what the real problem is versus my personality or the way I treat you or the way we argue about whether or not you're going to check something is a good thing. And then the second one is to say, here's a special way that I need your help. Number one, please don't belittle me. When I am accidentally asking for reassurance or surfing information on my phone when we should be snuggling, I'm scared, I'm worried, and I'm accidentally believing that I have to get a guarantee that things are okay. And I need your understanding. And the way you can help me is just say, it looks like you're just getting really worried about your health. Is there anything I can do to help you? And if you could say that, that would help me so much because it would just sort of jerk me to a little stop. I wouldn't feel bad about it. It helps remind me my real problem is my worry and not what I'm worrying about. And then if you're brave, ask them to stop giving you reassurance and to say, the way you could really help me is by not giving me reassurance and just reminding me if I ask you a question about looking at something or what you know about it, or if you've known anyone who has it, or if you've experienced it, the very most helpful, loving thing is to say, it looks like you're having a really hard time with your anxiety about your health. And I'm not going to help you if I answer your question or do this thing you're asking. I really care about you. And the best thing I can do is just say, I know it's really rough right now, and I shouldn't talk about that with you because it'll just make it worse. And it's helpful to give the language to your friend or your partner or your parent because they don't know what to say. They're used to trying to reassure you by saying, stop worrying, this is nonsense, it's okay. And of course, that doesn't reassure. And you want to show them how to commiserate with you or just share in the moment. Right now, I'm really anxious and I can't fix it for you. It's okay. I'm willing to stand here with you in the fire of your anxiety, but I'm not going to make it worse with giving you reassurance. And that would be the most helpful thing that you could say to them. Give them the language, let them know that it doesn't help to tell me, don't worry. I mean, if you think about it, that's absolutely useless in a way to handle it, because the person who's worrying certainly doesn't want to worry. That's like telling someone who smokes, have you ever thought of quitting smoking? We see that almost every single person who smokes or vapes wishes they didn't do it, and telling them to quit just doesn't work. So, does that answer the question?
Yeah, I think that's really just powerful too. Like communicating it can go a long way, and having the person that you maybe lean on for reassurance seeking, your partner, your parent, your friend, and then taking that out of the equation can go a long way and sort of force you into moving past this health anxiety, even if you're not necessarily ready to do so. And I think one thing I want to end on is for people who maybe aren't ready to identify that they're health anxious, what are some things you're missing out on if you're struggling with health anxiety?
Yeah. Well, the first thing that comes to mind is you're missing out peace of mind and enjoying your good health. And you're taking each time you get triggered and making it feel like it's the end of your life. And that's sad. And the reason that's sad is a long time ago, when I was in training, I got to work on an oncology ward. And I was running this support group, and I fully expected, in my 20s, like, oh, wow, these people are going to be so depressed and miserable. They all know they're dying. Everyone in this group has terminal cancer. And this group was a riot of fun and jokes. And everyone there had the attitude, I'm living it up because I know my days are numbered. I'm here to love others, to have fun. And they did not want to talk about cancer. Thank you. And I was all prepared, like, oh, wow, we're going to deal with this. And they made me realize something really important that most people in their 20s don't get, which is, your life is precious. Why would you want to waste a moment with anxiety, especially when you can do something about it and clear it out there? And I know that when people have this, they lose sleep, they're preoccupied. Other people feel like they're not fully present with them when they're preoccupied with their worry, or they're puzzled by them or frustrated by them because they see you're in obviously good health and then you feel like you're dying all the time. And it's sad. And so I would say, don't let health anxiety rob you of the experience of being fully present and able to enjoy the good health you have and the good moments you have. And part of the reason I'm saying that is because, yes, there is suffering. And yes, we all likely will have illnesses. There are things that we'll all die of. That's inevitable, but we don't want to live in fear of it. We want to enjoy every good moment that we have, like those men in the VA who knew they were going to die. And then the other thing that I would say is you've got to challenge those worry promoting beliefs. That belief that your job in life is to prevent bad things from happening to yourself or others. And I loved, Kendall, when you're talking about, you make that assumption that things are terrible. The truth is, the only time you need to take action against danger is when there's real danger. And the problem with health anxiety is there is no danger. It's all imagined. And it's an accidental imagining, and it's an accidental getting caught up in this worry. But you want to learn that you are competent to handle the ambiguity of not knowing what's going to happen to you, and that you can let go and enjoy, because if a bad thing really does happen, that you will be capable of learning how to handle it. And there will be others there who love you and will support you and help you handle it. And that you share in the human condition, where we all are going to have to die someday. And it is mysterious and it can be frightening, but we all can handle it. We just don't want to do it with anxiety.
Wow, Garen, that is an extremely profound and helpful way to end this conversation, because we have talked about so much relating to health anxiety and the origin of it, some of the behaviors and triggers related to it, and finally wrapping it around to your example of being on the oncology ward, and that the people who really are facing some grave situations and fates still hold a really good flame for life, and it is really crippling to have health anxiety and to go through that alone. And so we really appreciate this conversation and the tips and giving people the language in your lives, so they know how to navigate it with you. It's just been a very helpful, insightful conversation.
Oh, thank you, Kendall. And I really do hope anyone listening to this or anyone who reads the book can realize, I can have a much better life than I ever imagined. I can live with integrity, be responsible to my health or to other people's health with joy and without worry. I really can let go and live it up, because, my personal experience is, we were hardwired to live in love, in communion with other people, to have fun. We all work best when those things happen, and any kind of worry just is not meant to be there. And it's worth the struggle to get better.
Worth the struggle to get better. I love that.
Thanks, Cassie. Thank you so much.
Thanks so much, Karen. It was lovely talking to you. Are you constantly worrying about your health or health of a loved one? Do you frequently check yourself for lumps, bumps, tingling, or pain? Do you find yourself endlessly looking up symptoms on the internet? Perhaps you find yourself asking others for reassurance or validation that you're okay, obsessing over health scares in the media, or monitoring your blood pressure on an hourly basis. No matter how your health anxiety manifests, it can be a crippling psychological burden. Endlessly ruminating about illness and death can affect all aspects of life, at home, work, school, as well as at the doctor's office. And if you're obsessing over the health of a loved one, that can put tremendous pressure on the relationship. In Freedom from Health Anxiety, nationally recognized anxiety expert Lynn Cassiday teaches you skills to conquer health anxiety once and for all. You'll learn to switch from focusing on worst-case scenarios to appreciating the joy of the present moment, regardless of health status. Using a blend of cognitive behavioral therapy, positive psychology, and the author's learned inhibition model, you'll finally acquire the tools you need to take charge of your fear and break the cycle of stressing over your or your loved one's well-being. You'll also learn effective methods for tolerating health, uncertainty, getting in touch with your body's cues, and rediscovering the pleasure of the present. Visit our website at www.newharbinger.com and use coupon code podcast25 to receive 25% off your entire order.
New Harbinger Publications is an independent, employee-owned publisher of books on psychology, health, spirituality, and personal growth. For nearly 50 years, our evidence-based self-help books and pioneering workbooks have helped readers make positive changes to improve mental health and well-being. Founded by psychologists Matthew McKay and Patrick Fanning, New Harbinger is proud to be an employee-owned company. Our books reflect our core values of integrity, sustainability, compassion, and trust. Written by leaders in the field and recommended by therapists worldwide, New Harbinger books are practical, accessible, and provide real tools for real change.
If you enjoyed today's episode, we'd love if you rated, reviewed, and subscribed to the show, and we hope that you might share it with anyone who might benefit from the content. This podcast is not a substitute for counseling with a licensed provider.
Join the New Harbinger Clinicians Club, a free membership club exclusively for mental health professionals. Sign up today and you'll receive a special welcome gift, 35% off all professional books, free client resources, free ebooks throughout the year, access to private sales, a subscription to our Quick Tips for Therapists email program, and more. Visit newharbinger.com/clinicians-club for more information.